There are several challenges that have to be considered when ventilating premature babies. It starts with securing the airway. The children are very small, very vulnerable and very sensitive. This means that it is sometimes a challenge to start artificial respiration. We know that problems, complications, such as chronic lung damage can occur during invasive ventilation. And that is why non-invasive ventilation has been established during the last year so as to save children from such complications. One advantage of non-invasive ventilation is that, above all, we are less likely to damage the lungs. A great topic regarding invasive ventilation in recent years has been lung protective ventilation. We know that ventilation can damage the lungs of premature babies. There has also been great progress in invasive ventilation. However, the best way to avoid ventilation is non-invasive ventilation. And we can do just that. As far as the protection of the brain is concerned, it is above all a matter of brain hemorrhage, which is the greatest risk for premature babies to reduce. We know that premature babies tend to have very irregular breathing, which can lead to breathing suspension, so-called periodic breathing, which is often accompanied by the slowing of the heart rate, also known as bradycardia. And this is, of course, always a bit of a problem with non-invasive ventilation. If I see a patient who cannot be invasively ventilated and I can stop him from having dropouts, we intercept. The risk is a bit higher with non-invasive ventilation, but there are large comparative studies that have actually compared invasive and non-invasive ventilation and determined that the outcome, and by this we mean mostly complications during bleeding, is that both methods are equally safe. If we look at the advantages of non-invasive ventilation from the parent's point of view, then it is always a great shock for parents to experience seeing their own child in the NICU. The more invasively the child is treated there, the worse it is likely to be felt. On the other hand, it is a little easier for the parents to make contact when using non-invasive ventilation. This also means giving the child to the parents at an early stage. These are things that go easier with non-invasive ventilation than with invasive ventilation. The background to all this is the so-called developmental care for premature babies. We know that loud noises can impair the development of children, and we naturally make sure that we keep this to a minimum in the neonatal intensive care unit. Auxiliary means can be installed on the ward, for example, noise ears, so-called noise traffic lights, which use colors to signal us if the noise level becomes too high. Modern incubators, such as the Baby Leo, have already implemented such noise measurement in the incubator itself, and we try to train staff so that we learn more and more to avoid noises, to avoid conducting conversations close to the patient's bedside, preferably have them outside the room, and also to try to instruct parents to make the whole experience as quiet as possible. As far as sounds that occur during ventilation are concerned, it must be said that non-invasive ventilation has significant disadvantages compared to invasive ventilation. There are more noises, mainly due to the fact that we always have to deal with leakages, and these leakages simply make the airflow loud. Nevertheless, there are differences. We know that the quiet ventilator has advantages over the bubble CPAP system, for example, and here we may have to bring the high flow into play again, which is where by far the greatest noises occur. So, in the age where we know very well that we have to treat premature babies quietly and gently, new methods are also really good regarding this aspect. Non-invasive ventilation has now become well established in the field of neonatology. We know that it is a safe method compared to invasive ventilation, and that it even offers some advantages, for example in terms of lung protection. It is worthwhile to start with non-invasive ventilation, even with very small premature babies, at the limit of their viability, and if necessary, to be able to escalate. But it has become very important in the ventilation of a premature baby nowadays.